What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now in this video, we're going to talk about how to be a good MS4/sub-I. So it's 4th year of med school, and I made this video now because I have sub-Is coming on to my service as an intern, and I can see who's a damn good sub-I MS4 and who's doing okay. Alright. 4th year of med school is rolling around, you're doing your sub-Is, and you're like, man, I want to go into this specialty, I gotta do some sub-Is, gotta get some good letters, all stuff we've talked about before in old videos. But the question really comes, okay, so you did 3rd year of med school, hopefully you did well, hopefully you learned a lot, hopefully you're just clinically amazing. But what makes someone a good sub-I? Really, it comes down to a few things. Of course, you should try to have the best knowledge base that you can. And that's been like a core thing of this whole video channel I have, talking about how to do well in school, how to stay focused, techniques to use, resources to use. I've brought on people to share their opinions. That's been like a core thing of this channel, how to do well in school, no question. So try to have obviously the best knowledge base you can have. There's no question there. But don't let that slow you down. Like, you're not expected as a 4th year to know everything. You're just expected to know a little bit less than the intern. The reason I say that is because they're super stressing out the intern, trying to make that person run a service with like the little skills they have in knowledge base, while the senior's managing everything, with the intern. So you just need to know more than the 3rd year and a bit less than the intern, and you should be safe. If you know more than the intern, fantastic. More than the resident, wow, you're phenomenal. But knowledge base wise, just, you know what you know at this point. That's not something that's going to change overnight. So you go into it with what you can. So that's not really a big variable you can change in the short term. That's something you do. But there is a strategy to that. If you're going into a sub-I, say you're going into neurology, brush up on neuro stuff, review common things, stroke, seizure, migraines, headaches, numbness, review some localization, get really, you gotta know your neuro exam well. Basic stuff, you don't have to know all the rare things of neuro and all the different muscles and innervations. If you don't know it at this point, that's okay. Get the high yield core concepts down. You're gonna be doing a sub-I in surgery, obviously review all your surgery stuff. I don't know what all that is. But you should know how to round in surgery, you should know how to help in the OR, talk to seniors, get advice on what's high yield things that I should know. So from the knowledge perspective of how to attack sub-I, talk to people who are in that specialty you're going to be doing a sub-I in, preferably a couple years older than you, the intern, the R3, whatever. Get feedback and say, hey, that's what I did. I went up to a chief, and because I knew him, and I was like, hey man, I'm going to be doing my neuro sub-I. What is high yield stuff that I should really be brushing up on, because I'm going to see it? And we talked about different types of strokes, how to manage seizures, how to manage migraines, different things like it's going to give you inpatient admission, and how to think about it. So that's what I did. Do the same thing for your specialty. Think about what you're going to be going, you'll know what your sub-I is, talk to someone older, ask what are high yield topics, study for that, and then come in. So that'll attack the knowledge-based component. There's two parts, knowledge and your work. The work, honestly, is like 50-50 with knowledge, if not more. And there is like a third variable that kind of hovers over the whole thing. So knowledge we talked about. Second is your work. What are you doing when you're there, and how are you doing it? So what do people want to see in a good sub-I? They want to see that you're getting there early, you're focused, you're taking all the work you can, you're energized, you're part of the team. We don't want you to be an addition, we don't want you to be observing, we don't want you to be a 3rd year kind of gathering data. We want you to be functioning as a sub-intern. We want you to be seeing the patients, writing up the notes, history collection should be a breeze, working your best on the AMP, talk to the senior, talk to the intern, they'll help you out. They know it's your sub-I, they want to help you shine. That's what you're expected to do work-wise. And that kind of goes with that thing I was saying that kind of hovers over all this, is like, what sense do people get from you? Do you show up, oh hey guys, I'm the sub-I, do you want me to see that patient that came in overnight? Versus, hey guys, so I saw on the computer we got a patient overnight, I was kind of reading up on it, the guy's got like chest pain, man, like the EKG, whatever. That's two worlds of difference, and I hate to say it, I've seen sub-Is have come in on both sides of that spectrum. So be proactive, take initiative, take ownership of your sub-I. Those patients, see them as yours now. You're the doctor. Obviously you're being supervised by, a hierarchy of people who are going to help you, but having the mentality of, I'm the sub-intern, I'm going to have patients that are my responsibility, I'm going to get up early, I'm going to look on the computer, I'm going to see who came in overnight, I'm going to check in on my patients in the evening to see if they're getting all the things they need, I'm going to come in tomorrow already turned on, mentally knowing what's going on with the patients, and I have a bit of a plan in case things are going either way, versus someone who just shows up, is told what to do by someone, and then does it, and then is told again what to do. You don't want people telling you. You want to seem proactive. You want to seem driven. You want to seem like you get what's going on, and hopefully you do. If you're starting your sub-I and you're like, man, I just can't do that. I don't, I'm not doing what DocOssareh is telling me to do. Talk to your senior. Okay, this is another big concept. If you're not doing well, or if you don't think you're doing well, or if you're having trouble, talk to someone. Don't just sit at home and lose. Don't, complain and just be like, oh, I'll never get... That's going to get you nowhere. What your senior or your intern or whatever resident, they expect you to come up to them and be like, hey man, how am I doing? Give me feedback. In the mornings, what could I do better? How can I look better in front of the attending? Is there a way for me to check the patients at home? What do you do in the mornings? How can I do better? Ask for, be humble, realize you don't know everything, realize you don't know much of anything regarding like the logistics of how things operate, and be open to feedback. That's what people do in normal work. Everyone has their knowledge base, they know how to do stuff, but at specific places and hospitals and rotations, the people who are there really have it figured out, and that's what you want to do. You want to chime in and learn like the secrets or the background or the underground knowledge they have of how to be effective. So I remember even during my sub-I, I would talk to my senior and I would get there early. I would get there before the intern and I'd be like, so what do you do when you get in the morning? And he would teach me how he reviews patients and what he thinks when he goes and sees the patients, how he does his exams effectively, and that's all deep insight that you want. I mean, I could tell you how I do it, but it's different for every rotation. So if you're starting off your sub-I and you think, man, I'm not killing it, or you're, in the beginning of 4th year and you haven't done your sub-I but you're going to, but you want to get better, talk to your residents, ask for feedback, ask them what they do, express to them, I want to be good, I want to be a solid sub-I, I want to do better, give me feedback, teach me your techniques, I'm totally willing to do it. And that's what they want to hear. They don't want the kid who's, they have to direct. You want to be self-driven. You want to be the Energizer Bunny. You want to make everyone happy. And that's also, I think, the important part of like the sub-I and also the intern. You're there kind of for team morale. You're young, you're more energetic, you're having a blast usually. So be in a good spirits. Don't be all negative Nancy. Bring the morale. Bring it to the team. Make it fun. Be energetic. Don't be annoying, obviously, but bringing good spirits to the team, being driven, it makes the workday go better, and people are just going to like that better. So, knowledge base, you know what you know, but brush up on high-yield content and figure out that high-yield content by, you can Google stuff, but go talk to people who are going to do who are seniors or residents in the rotation at the location you're going to be doing your sub-I. Ask them for feedback, get tips on what's high-yield things you should know, and then for your work, show up early, know how to work, know how to see the patients, be self-driven, be aggressively managing, really be involved. Don't overstep, but really be active. You don't want to be someone that people are telling what to do. You want to be someone who's already doing it and people are helping guide you. And if you don't know how to do that, or if you need feedback, ask your senior. Ask your resident, tell them, hey, I want to do better, how can I? I want to be more like you. Whatever you got to say, get that knowledge, learn from them so you can become that effective as well. Hope you guys enjoyed this video. Maybe it was basic, maybe it was influential. It's my never humble and biased opinion, but I hope you guys like it. I really think that's what it comes down to. As an intern now, I have sub-Is, I have to do these evaluations, and I can totally tell. The kid who I have to keep saying, dude, did you go see that patient? Oh, we got one overnight, versus the other student who's actively following me and is engaged and is already like one step ahead. that person's doing much better. So to me, these concepts are what I see in people as sub-Is who are performing really well and those who aren't. Hope you guys enjoyed this video. Any questions or comments down below. Throw questions and comments on our Facebook page as well. Hope you guys enjoyed this video. Best of luck on your sub-Is, and as always, enjoy your study.